we move on to the next section. The next section is for all those aspirants out there who have an idea of taking up MRCGP exam. So the next topic is on MRCGP outline.
The chairperson for this session is Dr. Jachin Velavan, and the speakers for this session are Dr. Roshni Ganguly and Dr. Bala V.
Apologies that you have to see my face over and over again. It just, the sessions got switched and I've just happened to be there continuously, and so is Roshni and Dr. Bala. But just thinking of family medicine, there's so many avenues and so many ways of training and so many ways to equip yourself. And this is one of the avenues that we will hear today about MRCGP. So I invite the speakers, Dr. Roshni and Dr. Bala, to take over this session.
Good afternoon again. All right, so coming to MRCGP International, as Dr. Jachin just mentioned, that this is another avenue and an important one to get an exposure of family medicine in your career. So we are here today to give you a broad overview of MRCGP and how it is conducted, why in India, etc. And we are also, myself and Dr. Bala, are very happy to announce that we will be having the first exam of MRCGP International India in June 2023. And we are gearing up for that, right? So the objectives are what is MRCGP, why in India, how is it different from MRCGP UK, the components of the exam, how to prepare, and how the exam is conducted. Right. So basically, what is MRCGP International? It is again a branch of MRCGP UK. So this is the international or the South Asia branch of the Royal College, which conducts exit exams, and it has two components of one that is applied knowledge test, or the AKT, and the second one is the OSCE component, and we'll see how it varies, and we'll take you through some questions and role plays again. Now, the benefits of this post-nominal particularly, yes, it is from a reputable international postgraduate qualification. You have free access to many journals, e-learning, there are learning resources, GP online, and there are very many courses and learning materials available after you become or get awarded with the MRCGP International. Now, why in India and how is it different? Now, we have so many programs and very good ones like the DNB, the MD program, we have PGDFM. Here we, like the session in the morning, which I was speaking about communication skills. So this particular exam and the OSCE pattern is very different to what is conducted in the other exams, and that's what it makes the graduates maybe having a little different approach to the exam as well as if it implemented in practice. So we will take it step by step, and of course the overall intention is to focus on family medicine or general practice. It's to support because this particularly, if we have to implement family medicine in a large scale, it's not only MRCGP, but there are so many avenues, and we need to have an inclusive approach, because with 85,000 is what I understand is the latest graduate number, and with only 25,000 postgraduate seats, how are we going to fill up the gaps? How will we get more qualified, competent family physicians? So this is one other good avenue where you could opt for. Now, the aim of MRCGP South Asia is by shared certifying family medicine clinical exam relevant to family physicians, recognizing family medicine as a specialty. It is, and again, an assessment tool to drive learning, needs for the improving standards of general practice, and it provides a formal accreditation to promote the professional as well as the social structure, and of course to support the lifelong philosophy of learning. Right, I'll call upon Dr. Bala to take you through from here, and she'll be discussing about the eligibility and AKT part.
A warm good afternoon. Am I audible? A warm good afternoon to everybody. Actually, the morning session, Roshni madam has done the communication part. I think half of MRCGP is done with the communication skills. Before going into how to prepare for the exams, I'll just share my experience with MRCGP International. I completed my family medicine from Sundara Medical Foundation in the year 2015. And right from my house agency days, I was hearing my senior PGs, postgraduates preparing for MRCP, MRCS. I always aimed for getting a Royal College degree. So when thinking about how to go about MRCGP, because having come into family medicine, I can do MRCGP. I inquired about MRCGP UK. But they said that you need a year training in United Kingdom to be eligible for getting the degree, which was not practical for me at that point of time. So I went on searching what to do. Then came MRCGP International, Southeast Asia, which is for the Southeast Asian countries. And you need not undergo any training in UK to get this degree. Fortunately, I had my colleagues, 4 of my colleagues who were interested in preparing for the exam simultaneously. So we formed a group, which was very fortunate for me, because they kept me motivating, and when I was down, they used to text me, you have to read. So it was really a wonderful team. And all 4 of us gave the exam in 2019 June. I didn't have any idea. I should thank the organizers first for bringing up a topic like MRCGP outline. I never knew how to prepare for the exam. I just used to go to the website, seeing how to prepare for the exams, what materials to study, and each of us will collect some data on how to go about the exams. So I thank the organizers for making this session, which will be very useful for the aspiring family physicians. So this exam, as madam said, has 2 parts: the AKT Applied Knowledge Test and the OSCE Objective Structured Clinical Examination. What difference this exam, actually, basically, I initially thought of getting a degree. But after completing MRCGP, I felt that degree doesn't matter. It was a wonderful experience. I can't, only when you go through the exam, you will feel that. Say, suppose, initially, if a patient comes, for example, a patient comes to you with the complaints of swelling in the neck. You examine the patient and you find some lymph nodes. You just give them some, you find the focus, whether it is oral or ear or any seborrheic dermatitis, and you prescribe them antibiotics and ask them to come back after a week. But actually, the patient concern would be else. If having a swelling, the patient first concern would have been whether am I having a cancer? We would have not addressed that concern actually. I learned a lot of communication skills, and the way my practice drastically changed after completing MRCGP. So let me go on of how the eligibility criteria for appearing for this exams. A candidate who have completed a year's internship in family medicine or 2 years training in family medicine from an accredited national institute, or 1 year training program with additional 2 years of clinical experience, or if you have 5 years of clinical experience, of 3 years should be with general practice. This is the eligibility criteria for appearing for the exams. So as I said, exam has 2 parts. So part 1 is AKT. Here, in part 1, you will have 200 questions, which should be attempted in 3.5 hours. See, the AKT Applied Knowledge Test is mostly clinical application oriented questions. not recall-based questions or fact-based questions. So you should have knowledge and apply it clinically. So the question structure is very good. And if you have completed family medicine, structured family medicine course, to crack MRCGP it will be a little bit easier. So the study materials for this, I studied Oxford Handbook of General Practice. I went through some nice guidelines for the chronic diseases like diabetes, COPD and asthma, and WHO guidelines. See, in MRCGP International, they will ask questions about endemic diseases as well. So you might not think you will not get questions on malaria or tuberculosis. So you should go through some WHO guidelines. And apart from that, the online study material. You will have MCQs, say some 4,000 to 4,200 MCQs. You can work on those MCQs, go back, and wherever you're making mistakes in the MCQs, you can go back and refresh your theory part. So once you complete AKT, and one more thing, in AKT you will have questions from statistics. Statistics is very important in this exam. And for that, Park and Park will be a good book. It's a I feel Park and Park is a comprehensive book for family physicians. You can read up the basics of statistics and then attempt these questions and come back where you're going wrong. And once you have passed AKT, you will have 6 years to complete your OSCE or 3 attempts of OSCE, which was earlier. So the exam happens, as madam said, the exam happens twice a year. So these are some questions for the postgraduates. I want the postgraduates to answer. The parents of a 6-year-old child are concerned about multiple skin lesions that have spread on the face over the past 12 weeks. The single most appropriate management option. Only one option. There are no multiple correct options here. Answers from postgraduates. What is this? Yeah, exactly. Can anyone describe the skin lesion in molluscum contagiosum? Anyone? Yeah, very good. Excellent. See, this is a answer option. Answer, I want the answer. A, no treatment necessary. B, oral flucloxacin. C, topical acyclovir. D, topical fusidic acid. E, topical hydrocortisone. Yeah, excellent. Actually, the answer is no treatment is necessary because it is a benign self-limiting illness. This mostly it occurs as single or multiple papules, umbilicated papules with central caseation, and this mostly occurs in children, but it can happen in adults as well who are immunocompromised. So the treatment is not necessary as a benign self-limiting condition, but if they have any coexisting conditions like atopic dermatitis or the patient is immunocompromised, probably they will need some treatment. The second question. A 65-year-old retired man had a routine coronary angioplasty and stent insertion 1 week ago. He is now well and asymptomatic. He asked you for advice about driving his car. According to DVLA is Driving Vehicle License Agency guidance, which is the single most appropriate advice regarding driving. Select one option only. So here, even in our practice, we get patients coming and asking, doctor, I have done angioplasty. When can I go to my work using a car? Or you will be asked to give a fitness to the patients to drive. So this is very important area which you need to know. In MRCGP, there will be questions regarding the fitness for driving. This will vary from light vehicle to heavy vehicle. So you need not read up all, but the basic common conditions you need to know. So the options here are A, he may resume driving immediately. B, he may resume driving after a week. C, he may resume driving 1 month after the angioplasty. D, he may resume driving 6 months after angioplasty. E, he must inform the DVLA and wait their decision before resuming driving. Any answers from the PGs? Any try? Just try something, no? 1 month then? Any other? Okay, fine. I'll tell the answer. He may resume driving immediately. These guidelines, you can go through the online websites. You will be having the guidelines for major illnesses. See, there will be certain diseases which should be notified to the driving vehicle license agency. So if you have a pacemaker, think you have a patient with pacemaker comes to you. this should be notified. Having a pacemaker should be notified to the DVLA agency, and he can resume driving within a week. In case of any angioplasty, CABG, the person can drive, they can drive after 4 weeks of the treatment, CABG. So this varies from condition to condition. You have to read up. So, as I said, there is a difference in the guidelines between light vehicle and heavy vehicle. So you should be seeing to that. The next question. A 26-year-old woman is on day 8 of 28-day cycle and had unprotected sexual intercourse 12 hours ago. This is the first occasion within this cycle. She requests levonorgestrel 1.5 emergency contraception, but also wants a quick start of combined oral contraceptive pill. Having started the combined oral contraceptive pill, which is the single most appropriate length of time that she needs to take an extra contraceptive precautions, if any. Select one option only. A, 24 hours, B, 5 days, C, 7 days, D, 14 days, E, no additional precautions are needed. Answer please. No additional. Then, any other answers? Yeah, excellent. The answer is 7 days. So, mostly you will have questions in contraception from MRCGP exams. Either it could be from the mechanism of action of oral contraceptive pills, the adverse effects, or emergency contraception. Till how many hours or days can an emergency contraceptive pill can be started? Because this is very common in our practice. Yeah, excellent. It is within 72 hours. It is 85% protective. The emergency levonorgestrel 1.5 mg is 85% protective. So, if after that a patient comes, what will you do? If after 72 hours a patient comes to you, I have an unprotected sexual intercourse, what will you do? Yeah, excellent. We'll advise them for a copper T. So, and then we'll suggest them either copper T if they are going with copper T or combined oral contraceptive pill. And during that time, for the next 7 days, they need to have some barrier method as extra contraception till the combined oral contraceptive pills takes over its action. So, as family physicians, we get lot of gynec cases, and as females, when they come to us because they cannot tell all the complaints to a male doctor. So, as female family physicians, we should be thorough with the gynec part, and we should not refer patients for each and everything. Next question, this will be the last question. So, as family physicians, we get lot of psychiatric questions. We see lot of psychiatric patients per se because we have a social stigma of going to a psychiatrist. So, we should have a reasonable amount of knowledge regarding the psychiatric medications and their side effects as well. So, this is a question relating to psychiatry. A 50-year-old woman is taking methotrexate 15 mg once weekly for rheumatoid arthritis. So, she has developed a low mood, poor sleep pattern, and early morning awakening. She wishes to try medications as her symptoms are affecting her ability to work. Which is the single most appropriate medication? You have to select one option. A, amitriptyline, B, citalopram, C, lofipramine, D, mirtazapine, E, venlafaxine. Answer please. Yes? Citalopram. Excellent. Why citalopram? The people who have answered citalopram, why citalopram? Yes? I can't hear. Why citalopram? What is the classification of antidepressant medications? SSRIs. See, for depression, SSRIs are the first line of treatment, and these drugs are relatively safe to use with less side effects, and even in overdose it is very safe. So, you need to know the drug classification of antidepressants to answer these questions. What class of drug does amitriptyline belong to? Tricyclic, excellent. Mirtazapine? Atypical antipsychotic. Very good, very good. Venlafaxine? SNRIs, excellent. So, we need to brush up the basics for cracking this exam. It is not a tough exam. It is a very easy exam to clear if you have the basic knowledge correctly and you have to apply that. And for OSCE, it's a like tricky and a wonderful experience. You will have 14 stations in OSCE exam, and for each station will have 10 minutes. So, it will be like a examiner will not question you. They will be observing how you are performing the skills. So you will be assessed based on data gathering skills, communication skills, investigation and treatment skills. All the skills will be assessed. The question will be put up in the consultation room, so you have to act according to the question. So this OSCE will be a wonderful experience, and it will teach you a lot of things. So now me and Roshni madam probably will do a OSCE session, OSCE pattern session for you, a scenario now.
So just quickly through OSCE now, although this is not very clear, but the 4 domains, this is how the marking sheet looks like. So first is the consultation skills, which is basically, you will be observed throughout the consultation, and it highlights all the communication skills that we discussed in the morning. So you will be marked on that. There are 4 domains: excellent, competent, unsatisfactory, and poor. And next is data gathering, which is history taking, examination or counseling skills. So it will be either or. You will, of course, counseling is inbuilt when we talk of management, when we talk of, talking to the patient. But if it is an examination station, then it is going to be a separate one where you have focused examination. So focused examination means that you're not going to be doing examination of all the systems. It will be tailored to the presenting complaints and your differential diagnosis. And so you will have to have at least 2 to 3 minutes for your focused examination. And these are all simulated patients. These are not real patients. So they are being given a script, and they prepare it accordingly, and they will be giving you signs and signals. And when you only examine that particular relevant part or that relevant system, will you be given the examination findings by the examiner. That is a recent change which has been made. Initially, there was an examination card. So if you would attempt, for example, if it's a respiratory examination or if it is a thyroid examination, if you would attempt, the examiner at the end would show you the card. But now we have realized that, certain examination is not being performed, but in spite of that, they're getting the information and they get hints and clues. So we have changed it to only if you do this. So if you've missed auscultation in respiratory examination, we will not be giving you the auscultatory findings. If you've missed general examination, you will not be told about that. Only whatever you have examined will be told to you. Right? And the last part is the management. Of course, management is nothing but knowledge, I usually say. If you know it, you know it. You have to say the names of the drugs well. You have to talk about lifestyle modification. So pharmacological, non-pharmacological, and preventive. If you know it, you will be saying the correct things. And if you say vague things, the simulated patients are trained in such a way that they would immediately question you. For example, if you tell them you have to take certain blood pressure medications, they'll immediately ask you, what medications are you talking about, doctor? That means they want the specific drug name, they want the dosage and things like that. So that is how the OSCE is marked. Now, usually, as Dr. Bala mentioned, there are 14 stations with 3 or 4 rest stations. Each station, outside each station, you get 1 minute to read the candidate instructions sheet or candidate information sheet. Now, there can be only 3 combinations available, and usually, so they would say Mr. XYZ, 30-year-old gentleman has come to you with a complaint, and it would again have only these 3 combinations. So either it will be written, proceed with the consultation, including focused examination and management plan, which means examination is necessary in this particular station. You must do it. There could be another option where they say that proceed with the consultation and discuss management plan, in which you need to offer examination, and if the examiner says, they'll give you the findings. So that's an optional one where you have counseling, but you may need to know certain examination findings too. And there would be one only counseling station which would say proceed with the consultation and discuss management plan. Examination is not required. And usually there is no particular complaint which is given, so that the whole intention is to go in to each cubicle with an open mind. So they would mention the age, they would mention whether they have come in with their son or daughter or alone, and the vitals would be given, you know, either the pulse or the blood pressure, the BMI, that would be mentioned. They would not be saying that this gentleman or this lady has come in with a fever or has come in with abdominal pain. So that you just read the you know, the age and the vitals, and you go with an open mind, and how it happens in your clinic. So it is just replicating what happens in the clinic. You wouldn't know what the patient next is coming in, and that's how you go around 14 stations. So I think we'll proceed with we have time, so a short role play to demonstrate how in 10 minutes we will be, we usually do an OSCE exam. Yeah, the cases that I'll keep my own name. So Miss Roshni has, not Miss Roshni, yeah, she is the patient and I'm the doctor. So she's come in. So this is it. Comes to you with complaints of fever and cough, and proceed with the consultation, examination, and management plan.
Good afternoon, doctor.
Good afternoon. I'm Dr. Roshni. How can I help you today?
Doctor, I'm having fever and cough for the past 5 days, doctor.
Okay, so you say you're having fever and cough, both
Yes,
the
doctor.
things. Can you tell me a little more about it?
Doctor, the fever started 5 days back, and it is usually moderate, like 100 and 101. I have recorded the temperature, and I take paracetamol, and the fever subsides, and again I get fever, and
Okay.
cough started a day after the fever,
Right.
and I'm coughing badly, doctor.
Okay. Would you mind if I ask you a few more questions to understand your problem better?
No, doctor, yes, sir.
So you said fever is there about 100 to 101 degrees. Any shivering with the fever?
No, doctor.
Okay. Any body ache or headache?
Yeah, I have body ache and slight pain over the face.
Slight pain over the face you have. Okay. And but no headache.
No headache.
Okay. And when you bend down to do something, do you get any increased, headache or discomfort in the
Nothing
head?
like that, doctor.
Nothing of that sort. And you said about the cough that it has been quite bad. Now, when do you get the cough more?
Mostly in the night when I go to my bed,
I see.
I cough a lot and I'm not able to sleep properly for the past 4 days. And it is there throughout the day, but I feel the cough is more during the night time. I'm not able to sleep, doctor.
I see. Can I ask you what kind of a cough is it? Are you getting a lot of phlegm with the cough?
Yes, doctor, I'm bringing out phlegm and it is greenish in color, doctor.
I
I'm very
see.
worried about that.
I can completely understand that, you're worried about it. But can I just ask you, you said it's 5 days. So have you taken any medication for that?
Yes, doctor. I took some cough syrup which is available in the home. I thought I will recover with that, and I took paracetamol for the fever. And it's been 5 days, so I thought like I should consult a doctor. I should not wait anymore.
Sure. Just a few more things to ask you to understand your problem. Now, you said that nighttime the cough increases. Now, have you been having any allergies in the past, or getting cough on and off with any seasonal change? Or
Yes, doctor. I used to get wheezing during the winter months like November, December when it is rainy. And during that time, I used to take inhalers, doctor.
I see. What inhalers were you taking?
I used to take the one which is like they said it is something for prevention before. I used to take it regularly, but for the past 2 to 3 years I didn't have any episode, so I didn't use any inhalers. But now this is the first episode in this year where I'm bringing out a lot of phlegm and I feel difficult to breathe slightly.
I understand. So you're saying you have breathlessness too when you get the cough. Any chest pain?
No, doctor, I don't have any chest pain.
Okay. And have you had COVID recently or never had it?
I'm not aware. I didn't have any positive report, but I had fever once or twice. I don't know whether it is COVID or not, doctor.
Okay, okay. And how about your family? I mean, does anybody have asthma or any allergies in the family?
My mother, she used to take inhalers, and she is still taking. She
I
used
see.
to take, and she has some skin issues. The doctor has said that it looks like eczema.
Oh, I see. Okay, okay. And are you allergic to any medicines that you know of?
No, doctor.
And no habits, I presume, like smoking or alcohol?
No, doctor. No, doctor. I'm a
Okay.
teetotaler.
Okay. So let me just summarize that you said you've been having fever for the past 5 days and it's about 100, 101 and you've started a cough just one day after, and specifically the cough has been troubling you at night and you've been having some wheezing and breathlessness, and asthma or allergies do run in the family. Your mother still uses an inhaler and you've had it in past too. Now, with this, anything else that I've missed out that you would want to add on to?
No, doctor. I work in a chemical factory.
I see.
I don't know, but past 2 years I'm not having any episodes of wheezing. I'm working there for the past 3 to 4 years. But I always have a doubt on joining this company whether my wheezing will get increased because of the chemicals in the factory.
Right. So you're concerned about this new job of yours where you have to be working in a chemical factory, and with your wheezing, will it get anything else that is in particular bothering you?
Nothing, doctor. I have a pet in my house and I'm very fond of it. And people around me are telling that not to have pets because it will increase my wheezing. But I'm very fond of pets, doctor.
Right. So I do understand your concern. Let's go ahead with the examination and then we shall discuss. Okay. Sorry, we don't have a stethoscope. I'll just enact it out. So I'll be auscultating. Take a deep breath in and out. Again, take a deep breath. Can you say 99 for me, please?
99, 99, 99, 99, 99, 99. Crepes in the... Okay. Madam has examined me, so I will give the examination findings. So there are crepitations in the right lower base region with V's in all the lung fields.
Ms. Bala, after I've examined you, I do see that there is congestion in the left lower part of the lung, and I will be starting some medications on you. So since you have wheezing, we do need to give you inhalers. At the same time, because you said there's green sputum coming out as well as there's fever, and it's been about 5 days. So it is seeming to be a bacterial infection with wheezing. So do you understand what I'm talking about? Are you, or is it like?
Yes, doctor. I know because I have started inhaler the day I started having my cough. I took inhaler and a cough syrup. Okay. But I came to you because it's not settling with the inhaler and the cough syrup.
Right. So which inhaler are you taking now?
I took Foracort 200 inhaler, doctor.
Okay, okay. So what I would ideally recommend is I would want to do some basic investigations like a blood count. I would do the sputum test, okay, do a chest x-ray. And at the same time, once you give these tests, especially the sputum culture, post which I would like to start you on an amoxicillin and clavulanic acid combination. So that's 625 milligram 3 times a day for 5 days to be taken.
Okay, doctor.
Okay, and you may get some loose motions with this medicine. Certain people do get it. So I will be adding something called a probiotic, which you may use if it disturbs you. At the same time, I would give you an anti-allergic to subside this nighttime cough, which is very much due to allergies, and do continue your inhaler as well. With that, of course, paracetamol as and when required. So is that okay with you? And
okay, doctor. If my fever persists, then what should I do, doctor?
Yes, so I will be seeing you with the reports any which way after a day or two. And if the fever persists, or if you're getting blood in the sputum, or if you are having any other new symptoms, you do need to inform me immediately, and then we'll take it from there.
Okay, doctor.
Is that okay?
Yeah.
Thank you so much.
Thank you.
Thank you so much, Dr. Roshni and Dr. Bala, for giving us a bird's eye view of how the MRCGP international exams are run, what are the components, and how one could prepare for that. I'll just leave the floor open now for any questions. We're happy to answer. We have time for a couple of questions.
Yeah, there would be a couch. Here, of course, we didn't have one, so we did it. But yes, in all examination stations, there will be examination trays, and there would be a couch as well. Yes, sir.
Or in a accredited family medicine department. Can you please explain what accredited means?
Accredited, yeah, sure. Accredited means any postgraduate degree or diploma which is recognized by the national body of that particular country in South Asia.
I think that's something that needs to be, I think the AFPI and others should take that up, because
Yes.
that really destroys some of the ways of creating more family medicine training posts. If they still need to do a PGDFM or diploma in family medicine first. This looks like a good exam that should be independent, as long as they do posting 6 months in pediatrics medicine, then 2 years in family medicine.
So that option is there, sir. So it is either 2 years of training and then you can directly apply, or you may have 5 years of clinical experience with postings in different departments and you can directly apply as well.
Okay, so the different departments can be in any hospital that's got the state accreditation.
Yes, sir.
Yeah,
Yes,
so
sir.
Thank you. That makes it clear.
Right.
Thanks.
One announcement is that we have rolled out few forms on the WhatsApp group. I think Dr. Ramya We'll be sending it to you. Please do fill in your details, because when the exam, is just prior to the exam, the AKT is supposed to happen in May and the OSCE in June, this time in India, so we can reach out to you and make that announcement. So do fill up the forms and send it to us. Yeah. Any more questions? We are happy to take it. No, not with this. In Australia, you have an advantage. You don't have to give part 1, but not in UK.
You need to undergo a work-based assessment in UK. If you are going to write this exam and go to UK, you have an extra exam, assessment exam to finish before you get that.
In the United Arab Emirates, yes, you can directly go and work, and you will be given a lot of preference, and your pay is work, everything is at a consultant level if you do the exam.
Thank you so much, Dr. Roshni and Dr. Bala, and thanks everyone for the questions. I'll hand over to the next session.
I request Dr. Lizzie Vincent ma'am to felicitate Dr. Saravana Kumar sir, who has done the diabetic workshop.
Thank you, ma'am.